Okay, it is 12:01. We are going to go ahead and call the meeting to order. We did not have a courts subcommittee meeting this month, so it's a number 6 on the agenda, that we won't have that. The next item on the agenda is the approval of the minutes, so just need a motion in a second. I actually don't have copies right now, but I can send you it. Okay. The next item on the agenda is my report, and since our last meeting, I've created some mind maps that just kind of get our priorities that are highlighted during last month's meeting, which included mental health court, FTA clinics, PSA, pretrial services, program space, ankle monitors, and reducing continuances. Some of these have more detail than others just due to the nature of the programs and how much is entailed to get those programs off the ground. And for the PSA, I'm about halfway through the supplementary documents that from APPR, and hope to reach out to Arnold Ventures to start the implementation before our next meeting. I've spoken with both Fayetteville and Springdale PD regarding their diversionary programs. Fayetteville has a more robust program, but Springdale's working on their database to track diversions. Those would be the two main police departments that would track diversions. So Zoom no longer supports webinars, so we'll be holding our subcommittee meetings in person as well, and that's just going forward, we'll be doing that. And that's all I have. Are there any questions for me? Okay. So the next item on the agenda is the program subcommittee report. Judge Beaumont.
So fancy microphones and everything. Okay, so for the program subcommittee, we spoke a lot about mental health court and the different avenues on trying to get that going as quick as possible. We also are working on, and I think I've got a final copy of it, and I will send it out to whoever would like to see it for I'm trying to remember the title that we had for the person, diversionary case manager that Drew is going to kind of step into, at least initially, so we can try to get some numbers. And what we're going to be doing is we're going to be sending out a worksheet that will be given to individuals when they are arrested. And obviously, if they're going to bond out, then we're not going to focus on those individuals, but it just basically goes through, and I believe I have no objection from the prosecutor's office or the public defender's office in handing the worksheet out, and then the individuals will return that she will get those from the jail. It just has basic information. We're just trying to figure out if they're homeless, substance abuse issues, mental health, trying to let them know a lot of the different resources that are available, places for them to go. So hopefully these individuals at 8.1, especially the ones that have mental health, substance abuse, or homeless, that we can get them set up as quick at 8.1 as possible. And the goal is for this information to be Drew to get it very quickly, and then she provide, say for example, hey, this individual, I have him set up for an assessment at this for the Salvation Army by phone on this date, this time, and that way the public defender could give that information to the 8.1 arraignment judge to encourage them to be released with the services that they need so that they don't recidivate and they don't end up right back in jail.
Okay, the next item on our agenda is the pretrial subcommittee report, and Leanna Houston. You're good.
Never ask Matt.
No, I'd start pressing stuff.
Our pretrial meeting was a couple of weeks before the FTA clinic, so we focused on making our preparations for the FTA clinic, which we had on Tuesday. I'd say as a county, we owe a lot to St. Paul's Church for all the work that they did to help make the FTA clinic so nice with the food, the setup and everything. The room and the space we have is very nice, and it's close to the courthouse so people can get back and forth. And then we had our social work students set up the first room that had services, people who provide services to the community. And so we had several people there from the community to help. We had 61 people show up, 23 were felonies. 7 of those we got back on the docket and the rest pled. It's really, really nice that probation is there because as people were getting ready to plead, we got them their first appointment with probation, which helps them get off on the right start. And it also helps us when there's a revoke or something, we can talk to probation to see where we stand on that. And so that was very helpful, and I feel like it helps people then leave and they have their next appointment and they know, maybe prevents them from falling off what they're supposed to be doing so quickly. So that's really, really nice that probation is there. And then the other people were all misdemeanors, and John Comstock, Stan Adelman were there, and they helped talk to them and work with the district courts on getting them back on the docket, which helps keep all those people, so 61 people out of the jail. We don't have to do 8.1s on them and go through that process. So I feel like that went really well this week.
And then the next item is the FTA clinic report. And Matt, did you have anything to add to Leanna's?
Just I want to echo appreciation for St. Paul's for doing a lot of the heavy lifting, and I want to thank all the volunteers who showed up because that really, we're there. We have our lawyers there to do the end part, but there's so much more in the beginning that that gets done that helps make things so much more efficient. So I really appreciate everyone that shows up to volunteer, and certainly St. Paul's for providing space and providing everything that they do. I showed that we had 9 pleas out of all those. 7 of, I think, how many did you say were put back? How many did you say were put back on the docket?
7.
Okay. We had 9 referred back for arraignment, I believe. So 7 were put back on the docket, either for Judge Lindsay or Judge Taylor. So that is about that's about it. I would agree with Leanna that having probation there is extraordinarily helpful, both in getting cases resolved and the fact that on those pleas, getting them going from the start. A couple things I want to talk about. I wasn't there for the pretrial subcommittee meeting, but some of the things that we've been working on. Blake, Chancellor with the Public Defender's Office, he's been very good contacting me, identifying folks in the jail that can be moved up. So he's sent me several of those, and on most of them, it's people that have showed up and have failed to appear. So they've already had a prosecutor who's looked at the case and is familiar with the case, so that helps speed things up. There was one person who failed to appear for arraignment, so there wasn't, but by the time we got around to it, he had bonded out. Actually, he had gotten picked up on a warrant, I think is what it was. It wasn't an FTA, but it was before the arraignment, so no one had a chance to look at it yet, but before I could circle back with Blake, he had bonded out. So when we last met, there were some concerns about what we had proposed in terms of pretrial services. One thing that I'm working on and continue to work on is coming up with metrics for the quorum court to give them some more concrete details on what we're looking at and what our needs are going to be. And the best way I can really do that is coming up with just just a snapshot of a typical day in the jail and coming up with an estimate. I think that's the closest way to come up with an estimate on how many people we can expect to have needs for the pretrial services. And we'll have a better idea of how many people can be involved in the program, and that should give us a good estimate of the staff, and it will be justification, I think, for whatever we eventually request, which hopefully will be very soon. So I'm going to come up with those numbers, hopefully by the weekend, and basically it's criteria that's similar to the electronic monitoring with a few different things. It's probably not as restrictive as the criteria for electronic monitoring, but it'll be somewhat similar. So the unknown, which I had thought of, is how many of these individuals, say it's 100 people, and that's just, me pulling a random number out. Say it's 100 people at any given point. The unknown is going to be how many of those are going to end up back in because they're not complying with the conditions of their release. They're not checking in with their case manager, or they're not following through with their drug treatment, or they're not following through with whatever conditions. That's an unknown that we're not going to be able to figure out until we get started, but that shouldn't affect, I don't think that will affect the number of people that we're going to need to make this thing successful. So other than that, I think that's all I've got. Is it possible to post the agenda on the website with when we post the
Yeah,
whatever?
I looked to see if there was a way that we can add it to the event, and I couldn't find one, so I'll look into that for
Okay.
future. Okay, so the next item is just a discussion on mental health court budget, and Judge Stevenson's gonna help us with that.
Okay, so the biggest cost for the mental health care, or the mental health court, is going to be positions, staff. And there are a lot of outstanding questions I still have on that. So it's hard to estimate. Right now, I don't know exactly what we're going to need as far as some of the positions. And so I think this body could be really helpful filling in the blanks on that. And then we could get actual numbers for salaries and benefits for those people. So this is what I have listed, and I'm open to suggestions or whatever anyone else thinks might be appropriate. But for the staff positions, you would need a judge, which shouldn't be a cost at all. There's a caseworker therapist position that needs to be, I believe, and Kristen could speak to this a little more, but terminally licensed, meaning someone who doesn't need supervision, an LPC or a LCSW, that would head up the treatment or therapy part of the court. And just looking at the information Dr. Tyler provided me as sort of some salary comps, the budget on that is $50,000 to $60,000 just for the salary, and then we'd have to estimate benefits and the rest. And then the concept is that you would fill in the social work part of the court, hooking people up with services, figuring out what their needs are, with social work interns, which should be no cost, but then that would be something we would have to reach out to the social work department at the U of A to get started. So we would hope to have a couple of those. We need a program coordinator or a trial court assistant. I don't know if that's full-time or part-time. I really need feedback from the group on that, or opinions from the group on that. I believe we could use salary comps from just similar positions at the county. Judge Beaumont has a TCA. Maybe we could use that as a comp. Just someone to run the docket, be in charge of the docket, and probably do other things as well, because at least in our discussions of mental health court, it sounds like it's all hands on deck and you rely on people to do a lot of different things. Probation officer, I had a really good talk with Mike Parker last week, just trying to get his input on, what's the best way to fill this role. And he feels like a probation officer has a special, there's a relationship there that they try to cultivate that may not be compatible with also having that person be your bailiff or being the law enforcement heavy in the, if you need that in the courtroom. So I really respect Parker. He's been doing this for a long time, and I think that's good input from him. So if you're looking at getting a probation officer, I believe what Parker told me, it was 40 to 48,000 for starting. And then we would need a bailiff position, depending on where we would decide to house this. We might be able to use a county employee who's already employed to provide some bailiff services. That'd be something I'd need to talk to the sheriff about and get his blessing on. We also need a public defender and a prosecutor, and it's really up to Matt and Leanna. I believe they're in the best position to estimate the caseload that would be coming to the court and also estimate or give input on how we would fill that position. Is it full-time? Is it part-time? Can we use people already here? These are outstanding questions that I would have to have answered to estimate any kind of budget for that. And then we talked a lot at our committee meeting about peer recovery specialists. I looked today, there was a suggestion, I can't remember who brought it up, but that SAMHSA might have some grants that would cover that. I looked at what they put out for 2023, and I didn't see any grants that would apply specifically to what we need. But everyone agreed that, at least at the committee, that was a really helpful person or persons to be part of the court. And in some instances, they help provide just wraparound support for people, like rides, for instance, because transportation is a big question, I have. So that's something we would need to add to. And as far as, I think you would need to hire somebody at an hourly rate for that, if that exists, if you could find that. And I think the hourly rate that was thrown out there was $16 an hour. Judge Beaumont mentioned that DHS has money for peer support specialists, so that's something I still need to follow up on. So that takes care of what I have for positions. The facility right now is still up in the air where this would be housed, so that's still a question. We would need some money for software equipment. I think that's going to be minimal, but I still don't really have an estimate on that.
So I think you could just use the scales, which is the state system, which is set up for all the specialty courts.
So maybe that would be nothing, or is it?
It shouldn't be any problem.
So then, office supplies, that kind of thing, we would just have to figure out what we need when we have what the number of staff we would have and estimate that. But I don't think that is too much that we need to worry about it right now. The other two, big question marks I have are treatment costs, how that works. And I think that one thing that might be helpful, and I haven't talked to Drew about this yet, but I was thinking about proposing that she and I go visit with the Sebastian County, the personnel there, and really see nuts and bolts how it works. How do they bill for treatment? What are their funding sources for treatment? What are they spending on treatment? To just get some concept of what we would need to ask for. And then as a group, I would like to know, what are the possibilities for funding? Is it possible that you would have an account with money that was earmarked for treatment that you billed against, so that we could just say we think it might be about this much and then we would bill against it? I'm just curious how that would work. And then the other question mark is transportation. And sort of the vision that I have is that when someone would come into the program, the transportation is always going to be something that I think we would need to help people with. And it may even be that there's a weekly plan or something. How are you going to get to this appointment? How are you going to make it to court? There's some public transit here we could take advantage of. The peer recovery specialist might be able to help with rides. And then I looked at Uber Health today just to kind of see what that program was. And that is a program that will bill to a group or an entity for rides to healthcare appointments. I don't know why it's a special offshoot of Uber, except for that I think it's HIPAA protected. Is that correct, Kristen?
Yeah, that's my understanding.
So it looked really viable. I don't know if they work with nonprofits.
So I looked into it, and it looked like they only worked with healthcare providers. However, there is Uber Business that works with companies and other entities where you can order a ride for someone else.
So that kind of, that would obviously not be something we would want to use all the time. It sounds like it would be expensive, but it could fill in the gaps. And as far as estimating for costs, I just don't know. I'm just going to rely on this body to sort of do their best. I don't know what else to do, really, until we get into it.
Couple things, just thoughts from you talking. So like the peer recovery specialist, it would probably the best thing to do would figure out how much time are we needing from them. So that may be something getting with the drug court, if it's Benton County or Washington County, and go, okay, the person you're using, how much time are they taking? Because there's a potential there. So like I know for Benton County, all the peer support specialists work for Pearl, and reaching out to Pearl and go, hey, we're thinking we're gonna have court once a week, so definitely need them full 8 hours or more on that day. And then we may need some hours here and there throughout the week, but that's not a full-time position. So what you could do is say that, hey, we pay Pearl X amount of dollars to get their partnership MOU to provide the peer support. And then what you're doing is you're putting somebody that's what they do. They're really good at it. They're really great at getting grants to cover costs. So when I'm thinking long-term, they may go, yeah, we were able to get enough in grants to cover that cost, so it may not be an ongoing cost to the county. And so I would just like to think of any type of partnerships, keep it people in their strengths would definitely reduce costs and not increase the county employee number. And then also for, like when we spoke with the Jonesboro group, the RISA Health that did the mental health court, they were saying they initially got some funding from the county, but at this point, and they're years in obviously, but from their billing and the grants that they get being a part of a mental health court, they're fully funded. So they don't receive any funding outside of it. And it seemed like the groups that we talked to, same thing with the Benton County, those groups are fully funded after they've been up and rolling after a year or two because they're pursuing grants and they're finding ways to not continue to charge the county. So that could be a goal in the future, like when you're reaching out to a partner to say like, hey, if we did this for a year or two, would you be able to work to make it sustainable long-term? And they may have ideas that would make sense.
It seems like it would be a good idea to visit with whoever would be the best person with each of these mental health courts, just with the idea now that we have a budget. I think we went to look and see what they did, but now I have specific questions and just a little more understanding. So if Drew would do that with me, we could make some visits. And if this body, comes up with anything or has any questions that they think would be good to ask, then please shoot me an email and I'll see if I can get the questions answered. So that's really all I have under this for now. I know it feels like I'm just, I wish I could come here with more concrete information, but some of this is just digging and having more questions after digging.
I don't know if I've made it work. How many people do we think, how many participants do we anticipate will be in the mental health program?
That's kind of another unknown. And when it comes to the staffing issues, I mean, my preference would be to work with existing staff as far as it goes from my office, is to not ask for a new position in order to hold down cost and see where we are. Because, I mean, it could be a few people. It could be, a couple of dozen. Obviously, I don't think that we're going to get anywhere near the numbers of drug court, but I still think that, it could be, 25, 30 people. I don't know. I don't know currently. Do either of you know how many are in either Sebastian County or Craighead County?
Tell you that I've got 5 people that would be much more appropriate for mental health court than they would be for drug court, just off the top of my head. So I know Tara was talking about having it capped at least initially at 30 and seeing how that went. But there's a need. But I think a lot of it would depend on, what the prosecutors are referring over there. So, but I could start you with 5.
Wouldn't you have to take into account as well, like how many can be like on a probation caseload? I mean, what's a reasonable number for a probation case? What's a reasonable number for a therapist? What's a reasonable? So I think we did talk about 30 was kind of the initial thought.
And are we also anticipating that it will include misdemeanors, or is this just felony?
That's a really good question, and that's something I've heard different people say different things. I think what I would see more would be felony cases, just because with misdemeanors, I think there will still be judges that will send misdemeanor cases my way if there's a court, and they can do that just by order. So it should be really easy for the district court judges. Some are more. Some have more going on in their individual courts than others, so it'll probably depend on that. But I'm really looking at this. I would think the bulk of the caseload would be felonies. I'm not sure about that, but I would think so.
I would just say that I think 30 is going to fill up pretty quickly. I mean, if you're talking about just her 5 alone and the number of mental evaluations that are filed, even if you take a small percentage of that, I think 30 would be filled pretty quickly. In terms of doing a budget, I do tend to agree. I think you just kind of need to, I think we need to pick a number and base it off of that and see what the demand is, and you can always go back the next year and go from that. But I will say, I don't know, I think what she's saying about, if you're only going to have one probation officer or you're only going to have one therapist, then that seems to probably be what's going to control that number to begin with. But I think you're going to have 30. If 30 is your number, I think you're going to have 30 pretty quickly.
One thing we talked about doing was treating this as a pilot program, and I like that idea, just starting with one of each and then capping it for best practices. And I think 30, Mike, you could correct me on this, but is 30 best practices for a probation officer as well? 40. And then for the mental health professional, I believe it was 30 to 40. So it's very similar for caseload, and I like the idea of running it as a pilot program. If what Blake says is true and it filled up and it was successful, then that would be really good information for us, to add other positions. And we may also get into it and say, well, we don't need all this money for treatment. We're able to get most people, covered by insurance, or I guess it's hard to estimate right now. So I appreciate that you guys are understanding about that, because I wanted to come here with something more than what I have, but this is where we're at, so.
2 things real quick. One is that we do have a grants administrator who is starting soon, so that will be helpful. I can work with them to try and find some grants and get us some grants for specialty court and other programs that we're trying to pursue. And then also, last time I talked to Sebastian County, they had 40, but they were trying to add another parole officer so that they could go up to 80 because they had the need for it.
Comparable county, so.
With the opioid settlement, is that something we're going to pursue to get an X amount for treatment and judicial reform?
Yeah, I mean, we're open to any of that. I think what we're hearing, though, is that the opioid settlement funding has some very specific tethers to it. I mean, opioid treatment, so I don't know how that could coincide with the mental health court. Can we use somebody for both? I know that I was speaking with Director McAllister yesterday. They want to put a peer recovery specialist with the CSUs. We have a debate about whether we're ready for that in terms of our journey down that. Can we use that in conjunction with the mental health court to do opioids? I don't know. I think those are all very good questions we need to take to that group and see if we can get some answers for, because they seem very helpful to this point. We just need to get some clarification on some things. But yeah, I think we need to put together a program for that settlement fund anyways, to make sure we're not being redundant or anything. We need to put together kind of a steering plan, if you will, for that, I think.
And I think that would be a good use. A good use might be with pretrial services in terms of finding treatment options using that opioid settlement money. So I don't know where we are in terms of partners for that, but I mean, that's one big thing that I would envision with pretrial services, and having that possible avenue of funding would be very helpful. So that's something to consider.
I asked Kurt Lane for a while as far as what the money could be used for. Because I was thinking another probation officer, since our numbers are getting up, would be an excellent source of that money. But he said it could not be used for that. I know I've talked to him about using it to purchase Narcan, and that's something that I'm going to be harassing the county judge about, because the county has to be on board with it. Because in my opinion, every person in our program who has an addiction to opiates should be given the Narcan spray. And so we have not had that, and so that's one of the things we're looking at. He did talk about the fact that that money could be used for like an inpatient treatment facility for substance abuse. But it's going to have some connection with opioids and substance abuse. So I think it's probably going to be hard to stretch it to mental health, even though we all know that it coincides. They're pretty specific on they want it for substance abuse or those kind of treatment areas.
So Matt, were you thinking if the county had a fund, it could be tapped in by mental health court, drug court, pretrial services, as long as it's covering a inpatient treatment option?
I mean, I'm just spitballing. I mean, because
Yeah.
I think that it could certainly be used for treatment options, whether it be inpatient or outpatient treatment, which is why I thought it would be good for pretrial services, because a lot of the folks that are going to be participating, if not most of them, are going to have substance abuse issues. So that's why I think that it would be ideal for pretrial services. Now, I guess it depends on. I mean, when the judge is talking about a fund, setting up a fund, it's the folks that set that up will need to just kind of figure out how it's going to be used and how it's going to be. What are the parameters for it? Because we're going to have to be within specified parameters that are already set up for us. So I want to use it in any way we can to help out with a lot of these issues.
Yeah, I wonder if it's something that if certain groups got pre-approved MOU with the county that said, hey, if you get a referral from this county source, then you can go ahead and bill that person's stay to this fund. And so it's actually the facilities that the money's going to, and I think that would be easier to get those funds that way, because we're not saying, hey, drug court's going to have this or mental health court's going to have it. It said, hey, we're going to fund these facilities in our community to make sure that if there's a referral out there, they get the treatment that they need.
Yeah, I mean, I get that. I think all this is still in its infancy from what I understand with the opioid fund, but they're not really, I get the idea, they're not looking to partner with the governmental agencies. They're looking to
really?
partner with outside nonprofits.
Gotcha.
And so,
There's an actual fund that's just for county and city.
Yeah.
So that's what Kurt Lane is in charge of.
so, right, yeah, I know, but I think we disperse those to outside agencies. And so what I'm saying is if we have a program that works for Washington County, maybe we can also make sure it works with the mental health court if it has an opioid component to it. You know what I mean? So that this is all coinciding together and not, you know what I mean, separate things. I think that's a very much, we need to consider it all together.
Any other questions or thoughts? Okay. Thank you, Judge Stevenson. Next, we have public comment. It's 12 minutes, 3 minutes each. Just push the speaker button. Yeah, there we go.
John
All right, you're good.
Comstock. Hey, I just wanted to say thanks for the FTA clinic. I don't know what number the misdemeanor folks did, but it was Stan Edelman, Ray Town, and myself. We were busy from the second I got there, almost 9 o'clock, till after 2 o'clock. Ray and Stan were were the last two. Just know it was constant. We were on the phone with the court clerks, on the phone with the police departments, and I know, Drew, I reached out to you to maybe help facilitate, get the word out better to the police departments. They weren't as aware as the court clerks might have been about it. But typically, the court clerks will give us information, but then they refer us to the police department, because that's the only place, the warrant group is the one who can actually say, John, if you send so-and-so over here right now, we'll cite them out. They've already looked at the file, they've made that determination. A couple of times we had responses, we may not be willing to cite this person out. And in that case, obviously, we're not going to send them over there and tell them that they would be cited out, obviously. But we worked with the warrant officer and got it resolved where they were willing to do the cite and release. Just know this, every single person that we saw, almost without exception, had 4 or 5 or 6 outstanding warrants at 3 or 4 individual district courts. I mean, each person was a full case you're calling, and each one of them, they've got, it's failure to pay fines, it's failure to appear, contempt of court for failure to pay fines. It's all these things, and some of them were outstanding for as long as 3, 4, 5 years. But to me, the great news is, and I'm hoping, Matt, I don't know whether you've reached out to our Benton County prosecutor, but I'm sure hoping that you could maybe have another conversation, because we can't get Benton County to do it yet. But I just think of all those people, and usually they're there not just by themselves, but they have a family member. And I think about what that is doing for that family to get this warrant off their back. And of course, we're telling them, listen, this is a bite at the apple. You have got to go to court at this next, court date that you get. And hopefully, I don't know if you're able to track whether that's happening or not. To me, that would be something that would be nice, is if you could get follow-up on the FTAs to see when we send people over there and they tell them they're going to clear the warrant, what is our success rate about these people coming back? Because that would be nice to know. But anyway, thanks for doing it, and I hope maybe you already have committed to doing it once a month. If not, I would certainly encourage you to do it. Let it become part of the routine, part of the institution of your criminal justice system here, so people just know it and it becomes common knowledge. You can come to this warrant clinic and not put law enforcement officers at the risk of serving warrants, because that is one of the most dangerous things they do, because you never know what a person's state of mind is. You never know, particularly when you go to somebody's home. But when they show up at our
3
clinic,
minutes.
their state of mind is they want to take care of it. So And hey, the pretrial services, man, to me, that is I know these other things are smaller things that you're taking bites at the apple, but to me, that's the one that can give you the most relief on your jail overcrowding.
Just push the
Thank you, John. I think he's right about our misdemeanors. We need to have that more organized, and perhaps Judge Stevenson could help us with that, because we don't really have all of the district courts. Alexis Ward and Elkins reached out to me, and I'm trying to organize more with her. But I think if we could have a lot more help from district courts and maybe get the judges in district courts and all to help us more, that would be very beneficial.
I think what I could do is reach out to get an email for the clerk for every district court, and then reach out to the clerk and see who would be the best person for law, because John mentioned needing a law enforcement contact. So I could see who would be the best person in each municipality for that. And then when Drew sends out the flyer, she could send it out to everyone so they knew it was coming up. So I'm happy to start. I'll gather that up and see what I can do for that.
I do already have a contact at Fayetteville PD that I talked to today, and he said that if I send the flyer to him, he'll spread the word in Fayetteville PD. So, all right, go ahead. Just
Hi.
your name and where you're from.
Yeah, Haley Hall. I'm in Fayetteville. I just was wondering about mental health court a lot recently. I'm a licensed social worker, and I have a brother in Oklahoma with severe mental illness, and so I've watched him interact with police, and I was asking my JP about it, and so she said, come today. So I'm excited to hear that it's in the works. My biggest question is just housing. I know my brother lives in a group home for people with severe mental illness, and he's lived in many in Oklahoma. And in my research for Arkansas, because I'll probably be his legal guardian someday, I've hit a lot of dead ends with where he would be able to live unless it's with me. And so, anyways, I just wondered if that was a part of the conversation of the mental health court. I know there's, speaking of a social worker to help find housing probably, but in my research, I just don't know of any housing. So that's just my comment there. And I'm excited to see what comes from this conversation. So thanks for having me.
Any other public comment?
Good afternoon. Monique Jones, Fayetteville, Arkansas. I have a couple issues that I took from the meeting. Number one, transportation is huge. I think not even just having them work with Uber. I think this committee, even speaking with Joe Gardner with ORT and talking about on-demand routes and how we could get support from ORT, since that's funded by the city. I'm not sure if the county is funding any of the on-demand routes, and if we are, I think that's a partnership that we need to continue to go down that road with. I also had a question, and I guess John and I have thinking the same thing, is what is the success rate of the previous warrant clinics? Are we gathering data on how many people are returning? And that'd be nice to see that information shared here. Pre-trial service, and I can't say it loud enough, pre-trial service is something that we need to continue to talk about here in this space. And the last thing, I think, Drew, you said it, but I think it's bigger than just saying it and just sharing it with one person. The communication of the warrant clinics at on larger platforms than passing it between you and one other person. The way social media moves these days, we can get in touch with anybody we want to on social media if we're sharing that in different ways with different departments to ensure that people know warrant clinics are available. We gotta stop keeping it within ourselves and just sharing it on one platform. We have all these police departments within Washington County. Why aren't we sharing it everywhere that these pre-trial clinics are available to help individuals that have warrants, and making sure we're collaborative doing it not just within Washington County as well as within Benton County. Thank you.
To address you're right about we need to share it a lot more, but we are trying other platforms. I had law clerks and social workers out last week who are posting it at gas stations on the corners where the homeless people are, because they don't go to the police stations if they have a warrant. They don't go to the probation officer, and they don't go to the courthouse. So we can't just post it at those places. We need to find where they are. And so we were posting it at Seven Hills, the gas stations, Walmart stores, the street corner post lights, and things like that is where we're trying to hit. We're trying to be creative at looking at other places where they are.
I think if community partners in social work and social services in the community that interact with these individuals every day know about it in advance, that we'd share it with
You're exactly right. And I know that Beth and Sarah have talked a whole lot through in the past about posting and getting the word out.
Leanna, piggybacking on that, sending it to like Genesis Church and St. James and all the local churches would be probably great too, because I know they have a huge support system from the local churches, a lot of our participants.
I do send it to Mac Mayfield with St. Paul's and Lowell with Genesis Church. So.
And Drew, if I could just let everybody know, we had our biggest Marshallese turnout this time, at least on the misdemeanor desk. Yeah. A real big Marshallese turnout.
And Sarah Moore with Arkansas Justice Reform Coalition in Fayetteville, and I did want to speak to, as we've talked about the warrant clinic, we have been getting, as Arkansas Justice Reform Coalition, we have been getting those flyers and getting them out. And what John was talking about, and I did want to point out, there was a higher Marshallese turnout because we actually did work in that community more this time, but we are hesitant to really go full force because once folks do buy on and adopt to it, which I think will happen, I wanted to give you a heads up that we are going to really push into some of those communities more this next time. I think that we might be overwhelmed with the response, because once that acceptability of a few folks that they know in their community go and they have a good experience and everything works out, you know, that word of mouth spreads as well. And so, you know, we have been we'd asked for a while to make sure it was not just in English, we had Spanish and Marshallese. And so What we actually ended up finding out this time is that our translated flyer, and we always do a certain amount of English as the highest amount and less on the Spanish and Marshallese. We ran out of our translated flyers at a faster rate. And so this next time for the warrant clinic, the Arkansas Justice Reform Coalition will make sure that as we're putting those flyers out in the community, we've got more of the translated. The other thing that we do is we do share it amongst all the kind of nonprofit communities, trying to get them to spread the word as well. But I agree and echo the sentiment. The more places we can put it out where there's kind of those safe areas in collaboration, I think we'll see those numbers and the adoption of folks coming increase. And echo John Comstock, and in the event that the personnel are available and we can do it with more regularity, that I think that will just continue to help to keep the system from bogging down as much, because even the misdemeanors are keeping us from having booking happen, and that disruption of folks' lives, that interaction with law enforcement where they have to be off their beat whenever, they really know they're just going to book them through. And so it just helps efficiency through the way and saves taxpayers dollars and the stress to that family. So I'm really encouraged and really excited, and echo the comments that were made here before me about mental health court. I know there's still some questions, and I know we won't particularly maybe get everything right at the very beginning, but I really, your community is absolutely behind you, and we're very supportive, and know that there will be things to work through, but we want to continue to be a resource. Whenever we collected signatures for the petition to try to challenge the use of our ARPA money for the expansion of the jail, much of the feedback in the community of the 6,100 folks that signed this petition were that they really wanted to make sure that we were making investments in our community that would really help. Heard lots of personal stories of
3 minutes.
either the individual or someone close to them that had been impacted. So, this is going to make a big difference in our community. Thank you.
And this may be being done, but several of these meetings, we keep getting things about notifying here, or notifying this person. Do we have just can we not just create a general email account or a list and basically allow the community, if they want to be notified of this flyer, just add them to an email bulk
That's
list?
what I've been
Okay.
doing, and anytime somebody emails me and saying they want to be added to the flyer list, and then I send it out as soon as we get the translations and the finalized date. And
Okay.
so anyone who would want to email me, my email address is D, as in Drew Smith, @WashingtonCountyAR.gov. So. Any other public comment?
It's just that Tulsa has a very strong mental health court, and it's like 90% success rate. So I meant to share that. But if you wanted to just drive 2 hours, I'd go with you.
Time for one more comment.
Thank you, committee. Beth Koger, Fayetteville, Arkansas. I just want to kind of back up on what Sarah Moore just said, because we have been out in the community. We've been all over Washington County. I've been sitting in parking lots and churches and just all over. And out of the hundreds of people that I spoke with, only 3 people refused to sign the petition about stopping the spending ARPA money for the jail expansion. And a lot of people did not even realize that was happening. But I just want this committee to know that you have the community support. It's out there. Everyone, people were just so glad to hear that we were doing that, and they're interested in what you all are doing. They're paying attention. Thank you.
All right. Any other business? All right, motion to adjourn? Okay, go.
Are we moving forward with this, or is that not on today?
and that was, you took the words out of
Okay.
mouth. So do we need to have a formal motion for the health worksheet, and would anybody else like to see it?
Yeah.
So, I guess that's the first question. Does
Okay.
anybody else want us to send it to them?
Yeah, so I guess the first question would be, does anyone else want to see it before we move forward with, it's a questionnaire that we would give people on intake, where we would, okay. I will email it out. you have already sent it to me, so I will email it out and make sure that everybody sees it before next meeting, and we will formally vote on it then. Mhm. Yeah, just,
I just have Sarah and Beth's email, but I don't wanna wait till next month, Drew, no
Okay.
offense. So, it's pretty basic, it's just name, asking what they need, and then it explains kinda all the different programming, and it's just circling it and saying, hey, are you interested in this? And then Drew can follow up with them.
And I just kind of want to reiterate that this is, as it's been explained to me, this is not in any way a final say in this, okay? This is a very preliminary kind of trial run to see how this is going to work. So there's no, I want to make clear that there's no commitment that this is going to be the final product. But I do think that, as Matt talked about earlier, him and I have been emailing about clients that have reached out to me specifically. I think this would allow us to at least get a better idea of how those numbers would really look if we can get some kind of movement forward. I fully expect that this is not going to go as smoothly as anybody wants to start out with.
No.
But I do think that maybe moving forward and at least having Drew, if she's willing to at this point, start this process, I think would, even between now and next month, would lead to a much more fruitful discussion next month about how likely this is to help, how well that process goes. What Drew will see in this, I think, will control a lot of what we may be asking for and needing in the future. As Tara's talking about with mental court, or Judge Stevenson, I'm sorry, it's kind of impossible to estimate that. And I think moving forward with this would be a good way to try and get some better idea so that even next month we could have a more realistic discussion.
I would move that we go ahead and move forward with the questionnaire presented to the jail for individuals to fill out during booking.
I second that.
Okay. All right, Judge Beaumont? Voting, yeah. Jay Cantrell?
Yes.
Judge Taylor? Yes. Kristen McAllister? Yes. Leanna Houston?
Yes.
Matt Durrett?
Yes.
Judge Lindsay?
Yes.
Mike Parker?
Yes.
Nick Robbins?
Yes.
Judge Deakins?
Yes.
Judge Stevenson?
Yes.
All right.
And one other thing, I mean, and Blake may have been addressing this, and he may have been addressing something else, I don't know. But the list is a starting point, because what I told Judge Beaumont is that I'd gone through the list, but I haven't had an opportunity to sit there and think of if there are any other questions that should be asked. So at some point, we may be coming back to amend the list, but it's certainly an excellent starting point.
Fantastic. All right.
And Matt and I were talking about this before, I just want to clarify, there are a lot of, for the judges, if you haven't seen it, there's a lot of programs on here. As I understand it, between Matt and ours office at this point, there's really only 2 programs that are in contemplation of some kind of outcome to their case, which may be drug court or CAPS. The other things that are on there are only going to be provided as resources to them. I don't believe at this point, unless we have some discussion to move forward, that's not something we would be taking in front of the judges. That's not something that would be part of the outcome of the case.
Fantastic. Any other business? Motion to adjourn?
So moved.
All right. Thank you so much.